Good morning. Today is Monday, October 11th. This is a work session of the Health and Human Services Committee. I'm joined as always by my colleagues, Council Members Evan Klass and Councilmember Rice. Today we have one item on the agenda, which is to discuss a supplemental appropriation for $300,000 to, and we will be receiving an overview this morning and a presentation on the University of Maryland Support, Advocacy, Freedom, and Empowerment Center for Human Trafficking Survivors, the SAFE Center. The $300,000 will go to help underwrite the cost of the initiation of this very important program. One of the first constituent issues, complicated constituent issues that my office addressed, which I'm sure is consistent with other offices as well, was a woman who didn't realize that she was undocumented. Her husband had kept from her and had not filled out the paperwork for her to continue her immigration status. And there was a tremendous amount of abuse going on in this relationship, and she was trying to find a safe place for her and her 3 children. I want to acknowledge the great work that Ms. Harris and her team provided in assisting this woman in finding housing. But what became clear through that process was that there are very few options for people in this situation, particularly women fleeing domestic violence situations. And as I learned through that process, human trafficking takes on, unfortunately, many different forms. And so I know this committee and previous councils has done a lot of work to provide support, but this is another important step forward. And we're going to be hearing a presentation this morning about this important program. We're joined this morning by Ms. Amanda Harris, the Chief for Services to End and Prevent Homelessness within HHS. We're also joined this morning by Ms. Elizabeth Driggers, the Permanent Housing Administrator, as well as Kim Ball, the Homeless Services Administrator for DHHS. Ms. Deborah Lambert is here from the Office of Management and Budget. We also have Ms. Heidi Alvarez and Ms. Ashley Green from the University of Maryland Safe Center program, and we have Mr. Basu Moodley here as well. So with that, Linda, I'll turn it over to you to walk us through the packet and frame the discussion this morning.
I think you've done a really good job of framing it. This is actually very exciting partnership for the county to assist people who come to the Safe Center that are victims of trafficking and other really heinous situations, to help them to get into rapid rehousing so their housing can be stabilized and they can have permanent housing and not end up in the homeless system. I think that I would turn it over to Amanda Harris just for some opening comments, and then the representatives from the Safe Center have an overview presentation for you. This seemed like a really good opportunity to hear about all the work that they do, and then the committee would be asked to vote on a recommendation.
Great. Thank you, Linda. And thank you. Good morning, everyone. Amanda Harris, Chief of Services to End and Prevent Homelessness. I am really excited about this partnership. I think survivors of human trafficking is not something that we're always thinking about and is often invisible. And so I'm really excited that we're able to tackle this and offer some pretty effective interventions for this population. And I think it lays the foundation for future work for survivors of domestic violence, which are often intertwined. So that's all I have for opening comments. I would like to give Beth Driggers, our, what's her title? Homeless Services Administrator, Permanent Housing Administrator, just to talk briefly about rapid rehousing and the success of that program.
Thanks, Amanda. Yeah, it's Permanent Housing Administrator, but I answer to all those things. So good morning, everybody, and thank you for inviting us to come on today. Can you see my screen? Am I sharing? No? Okay.
Not yet.
Not yet.
I'm not a pro at Zoom screen sharing. Let me try. Sorry. Oh. It's not letting me share. Let me see. How about now?
There you go.
Yay, look at me. Okay, all right, so good morning, like I said. So I want to provide you a quick overview of our rapid rehousing program as a tool to ending homelessness here in Montgomery County. So obviously, okay. So rapid rehousing is a solution to homelessness designated to help individuals and families quickly exit homelessness and return to permanent housing. It's offered with preconditions such as employment, income, abstinence from criminal record or sobriety, and the resources and services provided are typically tailored to meet the needs of each unique household. Rapid rehousing has 3 core components. Obviously, first we have to find landlords and apartments to help people quickly move from housing from homelessness to housing within 1 month or less, helping people pay for that housing, whether it be short-term or long-term if needed, and then tailoring our services so that people can stay in their housing. Our results here in Montgomery County are 78% of households exit to permanent housing, 32% of them have increased their income, and our overall rate of return to homelessness after 2 years is between 15 to 17%. This housing intervention is a great intervention that's effective for our individuals, for both families with children, survivors of domestic violence, and victims of human trafficking. So at this time, I will try to stop sharing my screen, and I will hand it over to Heidi Alvarez and Ashley Green with the University of Maryland to give you some more information.
Thank you, Beth. And I am going to share my screen. Let's see. And sorry, just give me a second because I'm also having trouble seeing my screen. And let's see. There it goes. Okay. And I will go ahead. Well, good morning, and thank you for having us here today. My name is Heidi Alvarez, and I'm the Director of Special Projects at the University of Maryland SAFE Center. We are very excited to have entered this partnership with the Department of Health and Human Services in Montgomery County. And the reason why is because we know housing is one of the biggest barriers for survivors of human trafficking to be able to safely leave any trafficking situation that they're in. And just to give you a sense of the clients that we serve at the University of Maryland. So since 2016, we've served 185 human trafficking survivors, all of which hail from the United States, Honduras, El Salvador, the Philippines, and many other countries. Of those, 91.2% have been women, and 8.8% have been men. And 62% of the cases that we have served have been sex trafficking cases. 30% have been identified as labor trafficking, and about 8% both sex and labor trafficking. Of those, 79% of the cases have been between the ages of 18 to 35, and 10% under the age of 18. And then 9.6% over the age of 35. Of these, 36% have been clients who have resided in Montgomery County or have been trafficked in Montgomery County. And I wanted to give you an overview of the services that we provide at the SAFE Center. So we are a partnership between the University of Maryland, Baltimore and the University of Maryland College Park through a strategic partnership called Empowering the State. And our goal is to provide direct services and engage in research and advocacy. So at the center, we currently provide a number of different services for the survivors that we served, including case management, economic empowerment. That means providing clients with the resources to find jobs and to enroll in educational programs. We also provide legal services, including immigration, legal services, and also criminal justice advocacy. We also provide clinical mental health services. So all of those services work in tandem through a multidisciplinary approach to really holistically serve the needs of the survivors of human trafficking that come to us to the center. In addition to that, we also engage in research to really fill gap in knowledge, best practices, and how to serve human trafficking survivors. And then we also promote advocacy through policy advocacy at the state level and federal level. And in particular, in Montgomery County, we actually also provide services to youth through the Regional Navigator Program, where our staff members, our case management team, actually goes to the juvenile detention facility, Noise, and to help identify and to advocate on behalf of survivors of human trafficking who are under the age of 18. So this program in particular, this partnership, is a federal program that is funded through the Office for Victims of Crime. And again, one of the reasons that we applied for this program in partnership with the Department of Health and Human Services is because, as I mentioned earlier, stable housing is the #1 gap identified by advocates for survivors to be able to really leave their trafficking situation in a safe way. We know that emergency shelter oftentimes doesn't meet the full needs of the survivors that we serve, and it's only for a short period of time. So really in order to get them back on a path towards recovery and healing, having housing and safe housing at that, for themselves and for their families is really, I would say, one of the most important aspects of their path towards recovery. So the goals of this grant are to help survivors stabilize and obtain safe housing, to provide support to survivors on their path towards independence so they can pay their rent and other household basic needs. And we do that, again, in tandem with the wraparound services that we provide at the Safe Center. And lastly, to provide those wraparound services so that any other needs that the survivors that we serve have, whether it's medical needs, employment needs, legal needs, all of those are really taken care of through the wraparound services and the other teams that we have at the center. And really, as I mentioned, the pillars of this program are to look at it from a holistic perspective. And at the center, we have a number of different services that we provide specifically for this program through our economic empowerment team. We will be able to help our clients who have educational needs apply for high school, apply for a GED program, for those that are ready to enter college, work on that application for college. We actually also, in partnership with the University of Maryland College Park, have an English language online program called Advocacy, where we have provided Chromebooks to our clients so that the clients who do not speak English very well and who need that support are able to access these online English classes through this platform called Advocacy. In addition to that, we've been able to provide clients, especially through the pandemic, with internet access through jetpacks, mobile hotspots, so that they're able to access any online program that they're interested in, and also be able to continue receiving services via remote services in conjunction with the Safe Center staff. And then the other part of that is through economic empowerment, and that is what Ashley, part of her job is to help clients who need employment assistance look at what their skills are, understand, really where they want to go in terms of their career goals, and then search for and apply for jobs. We also provide tax preparation services. We have budgeting classes, and we provide mentoring through a volunteer program. So the core programmatic components of this program, in particular of the housing program, is to provide tailored assistance. As Beth mentioned, we would be providing financial and non-financial assistance for each household, including rental assistance, moving costs, and housing search assistance. We would also be providing housing identification through this program, removing barriers to housing access, making sure that the client understands their lease agreements, helping them with contacting landlords, and accessing voluntary case management services. And I'm going to hand it over to my colleague, Ashley Green.
Good morning, everybody. Again, my name is Ashley Green. I'm the Economic Empowerment Coordinator at the SAFE Center. And I'm just going to go over the eligibility criteria for the program. And the target population we're going after for this housing program would be 15 clients and their families. We want to be able to provide support to either 15 individuals and families to provide them with housing, get them into a safe apartment that's affordable, and assist them with housing, rent, and utilities over the next 18 to 24 months. The eligibility requirement or criteria is just being a survivor of sex or labor trafficking in the past or recent history, or currently it's happening and you need to get out of that situation. And again, we want to help them over the course of 18 to 24 months with bills and the costs associated to that apartment. So the SAFE Center Economic Empowerment Coordinator, which is myself, and the Rapid Rehousing Coordinator will serve as the main points of contact for the clients in all of the programs. So their needs or any questions or anything that should happen while they're a part of the program that they need assistance with, we will be their point of contact. The SAFE Center Economic Empowerment will also complete client intakes, and we'll be able to provide a warm handoff to the Rapid Rehousing Coordinator. So basically what that means is as clients come through our program and they wish to be a part of the housing program, I would do a short intake with them just to make sure they understand the program, they qualify, and pass them along as quickly as possible to the Rapid Rehousing Coordinator. The Rapid Rehousing Coordinator will also meet with the clients to determine their financial needs and provide safe housing options, which would include assistance with looking for an apartment, completing the application, and the introduction of the program to potential landlords. And then finally, myself, the coordinator, the Economic Empowerment Coordinator, along with the Rapid Rehousing Coordinator, will maintain an open communication to help troubleshoot any challenges that their survivor may experience, or again, any questions that they may have. Oh, and that's it. So if there's any questions or comments, anything that me or Heidi can answer, we would love to at this time.
Thank you so much. We can take off the PowerPoint. Perfect. I have a couple of questions. I'm going to hold off, though. My colleague, Councilmember Rice, has some questions and thoughts. Councilmember Rice.
Well, thank you, and I'll try and be brief because this money is definitely needed, and so I'm very happy to see SAFE Center working in this space and continuing to provide the stability of housing. Some of you know that I serve on the Montgomery County Human Trafficking Task Force along with Council President Hucker. And so one of the concerns that I have is that a lot of people haven't been paying attention to this. All of the conversation has been around restrictions at the border. However, with H-2A visas, the United States actually opened up for migrant workers that they said were essential the border and let folks come in. Well, what we also know that as a part of that legal cohort of folks who are actually coming to work, we also had an infusion of folks who were being trafficked who also were able to then come into the United States as well. And so part of our focus has always been on prevention as well as restoration. And so from that perspective, I just wanted to kind of get your thoughts. I think this is perfect in terms of how we try and get folks back on track. But what more can we do when it comes to making sure that people are aware about the continued scourge that we see with folks being trafficked in through our borders through the auspices of legal migration, when in reality it's there to continue to proliferate criminal enterprise?
Thank you, Councilmember Rice, and it's very nice to see you. Well, thank you again for having us here this morning. I know that the Human Trafficking Prevention Committee has been working diligently, right, to engage in both social media and just public awareness of human trafficking. One of the ways that I think we can engage in prevention, I think it's actually twofold, right? So for example, one of the projects that at the Safe Center we've undertaken is a prevention work to provide in the schools, whether it's through middle school or through high school, in prevention activities, really targeted both to the school administrators and school resource personnel, but also to the students themselves. And in addition to that is also having that connection and interaction with their parents and bringing attention and awareness to parents about what human trafficking is, because it may be happening to the parents themselves, but it may also be happening to youth as well. So I would say that is one, I would say a strong way that we can move forward through prevention, providing resources in schools, but then also providing the information and awareness with parents as well. Because you know, many of the immigrants that are coming into the country are parents, right? And so they're going to be enrolling their children in school. And so we want to make sure that they have all of the information and resources necessary to know what they can do if they've gone through trafficking themselves, but also to prevent any trafficking from happening with their children.
Heidi, that excuse me, that is terrific. Let me just say thank you, because I hadn't thought about it from that perspective in terms of thinking about how we do that twofold approach, right? It's kind of like that multi-generational approach where we're working with the parent as well as the child, understanding that they too can fall victims to trafficking. We know that we've already seen with the whistleblower talking about Facebook and TikTok and Instagram and all the things that are out there. We know that those serve as platforms for the other forms of human trafficking outside of labor, which are sex trafficking. And everybody thinks now that sex trafficking is just a person having sex with another person, but there's also forced, you know, being on a webcam and making money for an entity. That's the same thing. That's also still sex trafficking when someone's forced to do something that they don't want to do to help someone that profits, that they don't get anything from and is against their will. It's those kinds of things that we need to continue to highlight. So thank you. I think that's a great approach, and I'm going to make sure that we follow up with MCPS. I'd love to continue to work with your office as we always have been, because SAFE has continued to be a leader in this space in terms of really getting our folks back on track. And thank you, Amanda. Thank you, Ashley. Thank you, Basu, and thank you, Beth, for all coming together. This is really important because so many people feel as though, you know, when we were dealing with our massage parlors and other kinds of things, the question was, well, where do we go at that point, right? When we rescue and save someone, then what happens? And it's similar to with our homeless population. We've got to have that seamless integration of those next steps so that folks see that there is a pathway that they can get out and become stabilized. So I think this is fantastic, and just thank you so much. Back to you, Mr. Vice President.
Thank you.
Thank you, Councilmember Rice. Thank you so much for your leadership in this space. I remember the thoughtful deliberation and discussion we had around your bill that you co-led, which raised a lot of awareness around the massage parlor issues here locally. So thank you for that leadership. Councilmember Glass.
Thank you, Mr. Chair, and I too want to extend my appreciation for Councilmember Rice for elevating this issue through his years of public service and through his work here on the council as well. As we try to figure this out, right? Because you institute one regulation or one law, and it is quickly undercut either by technology or just by human ingenuity, I guess, right? The criminal mind is what we would call it. And so thank you for your work there, and thank all of you as well. I'm pleased by this grant opportunity to continue working with you all in this new way. And everything that I wanted to say was said, but I just have one question about, if I recall, it was 13 individuals that this would help fund or help support. Is that correct?
It's 15 individuals or families.
15 individuals or families. Good. And I know that between, I'm just curious, how you all identify them, right? How does this work? Take us to that next level, because trying to distinguish between sex workers and what was the other terminology? I'm looking at it right now. Forced labor. How do you help identify those individuals? How do they come into the program? How can we share this program and this opportunity with the public? If they see something, say something, essentially.
Thank you so much for your question, Councilmember Glass. So at the SAFE Center, we actually use evidence-based tools to identify survivors of human trafficking. And so whenever a referral is made to us, and it may be by law enforcement, it may be by a member of the community, maybe by other community agencies, we have a very structured approach when we meet our potential survivors, and just first making sure that their basic needs are being met, that if there's any kind of emergency need that they have, whether they need to go to the hospital or they need to be placed in an immediate shelter, that those needs are addressed. But once we've met their immediate emergency needs, then we actually walk through an intake process where we do ask questions to better ascertain what the situation actually is, right? So whether or not this is actually a trafficking case, because we do have to meet federal guidelines for what human trafficking is, or if it is a situation where maybe there has been some sort of exploitation, but it doesn't quite reach the level of trafficking that, again, that we would define. And in those situations, we still want to provide that individual with resources to the community. So we're not just leaving them hanging, we're really connecting them with other community resources. So that is our first step. And then for this particular program, again, at the SAFE Center, once that initial intake human trafficking assessment has been completed, then they are paired with a case manager. And so that case manager really works with the client to identify all of the needs that they have. And again, through that process, we use an evidence-based tool called the Adult Needs and Strengths Assessment and the Child Needs and Strengths Assessment. And so through that process, and again, in conjunction within our multidisciplinary team, we identify the different needs the survivors that we are serving have. And so if one of them is housing, then through that process, they will be then referred to Ashley in order to do that initial housing needs assessment to really determine whether or not they will be able to be served through this program if they're ready. Again, this program, the eligibility criteria is really broad because this is based on the OVC for Victims of Crimes guidelines, but we do want to make sure that we're serving clients that really need that immediate housing. And so once they've been referred to Ashley, Ashley will then make that determination whether or not we're able to serve them through this program, and then provide that warm handoff to the Rapid Rehousing Coordinator. Ashley,
Well,
I don't know if there's anything else that you would like to add to that.
No, I think you covered everything. So, unless there's a second part to the question.
no. I was just curious, right, and how the internal deliberation for this holistic care, right, the evaluation, and I understand the federal guidelines are necessary, right, to make sure that victims, meet a certain level of criteria so that they can be eligible for this program, and then the thoughtfulness and the deliberation and the care between your teams and then ultimately the county as well as we work collectively to provide these services. So I appreciate this opportunity. I know that we're all going to be interested in to see how it unfolds, but thank you again for being involved in this work and for partnering with Montgomery County to help those who really need help in this time. So thank you all.
Thank you, Councilmember Glass, and thank you for your work and that of your team to end and prevent homelessness, as well as our lead on the council on those really critical issues. A couple thoughts. The first is, well, as a Maryland alum, I'm very proud that the University of Maryland is engaged in this system and in this really important work. So just kudos to as a former Terp. So from 30,000 feet, we've received some briefings over the last 2 years through COVID and the pandemic that the number of cases reported had gone down, but the severity of those cases had gone up. And as Councilmember Rice noted, especially in light of the immigration issues on the border, which I saw firsthand, as I've shared with my colleagues before back in May, on the Mexican side of the border, families who were just as vulnerable as you can possibly humanly be. And so just totally victim to so many different things. The drug cartels ran this plaza that I was in and put up porta-johns, and were charging between 15 and 30 pesos to access those porta-johns. And so it's awful. So I just, what are we seeing holistically just in this space right now? If you can talk a little bit about trends. This is an incredibly important pilot, will be life-changing for the 15 families who we're able to serve. But as we know, we want further investments. And so if you could just somebody could provide a little bit of that context now, if you're able to, that'd be helpful.
Well, it's interesting because I think at the beginning of the pandemic, you're right. I think there was a decline in services, and I think it was because many agencies who would normally do in-person work with clients really had to quickly pivot to providing services remotely. And so that meant bringing all of our staff up to date on technological needs that they had. And then also, I think, introducing our clients to those types of services as well. And actually, Basim Moodley, who's my colleague at the center, just want to commend him. He did a fantastic job in really helping us to provide those Chromebooks, which are so important, and then also provide the training to the clients. I would say that after that initial lull, we actually did see an increase in clients that needed assistance, who were victims of trafficking. And I don't necessarily know that they were from the influx at the border per se, although we do know that there is a transition that happens from, let's say, Texas to Maryland. So we do see that, especially because we're connected to I-95, which is a major throughway that connects to other parts of the United States, specifically to Florida. So I do think that I wouldn't be able to answer that particular question, but I would say that we did see an uptick later on as the months went by, because the need of survivors was so great due to the economic crisis that we went into because of the pandemic, right? And so particular clients who lost their jobs or were even isolated because of the pandemic would reach out for support and for needs, especially reaching out to the National Human Trafficking Hotline, and then through the National Human Trafficking Hotline being connected to service providers throughout the country. So I would say internally at the Safe Center, we actually did see an uptick in cases that were referred to us. Mostly sex trafficking cases. And as I mentioned earlier, we do have a partnership with the Department of Juvenile Services where we serve youth in the Children's Center. And so cases that came through that, through those referrals, but also cases that came through our law enforcement partners and other community agencies. So again, I wouldn't be able to speak to that trend in particular in terms of the migrants coming through the border. But I would say that, we, again, initially we did see a decline, but then an increase as the months went by and the need became great because of the pandemic, the financial need. And I would have to say that Montgomery County was very resilient in providing financial assistance, particularly for housing. I attended some of the Montgomery County Rentals Alliance meetings, and I would say I would commend the county for quickly providing housing assistance that was needed for many people in the community, trafficking survivors included.
Thank you very much, Ms. Alvarez. The next question, I guess, is for Ms. Harris and Ms. Driggers. So in terms of, the identification of the physical locations of the placements, of the housing placements, I know this covers rent for between 6 months and a year, but given the unique circumstances of these families, what are on the county's end as we identify, it's much more complicated than just finding a place for them to be able to go. Could you talk a little bit about, from HHS's standpoint, how we're working on identifying appropriate locations, safer locations, given the very complex nature of these cases, and how we're making those determinations?
Sure, I can speak to this, and Beth, if you want to add anything. So this is a rapid rehousing program. So we are connecting people to independent units in the county. And I think the most important thing is working with the participants about where do you want to live? Where is going to be the safest place for you? I think what is so great and unique about this partnership is that although rapid rehousing traditionally provides case management, it's much more about connecting people to those longer term services. That's the role of the rapid rehousing case manager. But with the Safe Center, they're able to provide those really intense support services in complement to the rapid rehousing traditional case management. So I feel like wherever we place, those services are going to be there. Now, I will say, just in general, it is getting harder and harder to find units in the county. That is a real issue, and it is causing a bit of a bottleneck in us being able to get people connected. We have a lot of money invested in rapid rehousing, not just for this population, but just in general, and through the CARES Act, American Rescue. But actually finding those units is becoming harder and harder, and rents are going up, unfortunately. So we don't want to put someone in a housing placement that is not going to be sustainable in the long run. So we're really trying to make sure that once the subsidy ends, that they'll be able to continue in that same place. And this is, I think we're aiming for a longer term subsidy. Traditionally in rapid rehousing, we would do in 6 to 9 months is our target, but recognizing the unique needs of this population, it is going to be a longer term subsidy. So probably averaging more around 18 months up to 24 months.
Thank you. That's really helpful. And the intersection is so clear here. And speaking of the intersection, the prosecution of these cases are complicated. They're difficult, to say the least, but critically important for us to be able to stop these trafficking situations from occurring in the first place. I know that at least in Montgomery County, our judicial branch has been proactive in trying to address issues of trafficking and domestic violence, and our state's attorney's office has a unit assigned to this work. But can you talk a little bit, Ms. Alvarez, or about sort of that aspect of this? How are we supporting the families, through the judicial process as we try to prosecute these cases and stop the endless and awful cycle from happening in the first place?
Thank you for that question. So, you're right. I think that's a really big part of really ending human trafficking and trying to address it, is being able to prosecute these cases. At the SAFE Center, as I had mentioned, we have a legal team. And so through the legal team, we provide immigration legal assistance for our clients who have been trafficked to the U.S. for the purposes of engaging in sex or labor services. And so depending on the client's individual case and what the client would like to see happen, we may be able to refer them either to law enforcement locally or to our federal partners. And that is something that we see as critical, again, especially because in some cases, it may not just be our client who's being affected by that trafficker, right? There may be others that are continuing to be victimized by that individual or that group. And so for us, I think that's a critical part of the services that we provide, is being able to make that connection when the client is ready to our law enforcement partners and to prosecutor's office. And then in addition to that, also being able to provide those victim services need if the client is involved in a criminal case. And so through that, we provide criminal justice advocacy. So, I think it's imperative. I think it's part of the, when we think federally and through the state, the goals of preventing and ending human trafficking, you have to do that in conjunction with our law enforcement partners and prosecutors' office. So, I think that's something that we continue to strive for, and really making that connection once we begin providing those legal services to our clients.
Terrific. Thank you for that answer. And I think maybe in the future, not this fall, but maybe this spring, we may want to have a joint session with our Public Safety Committee talking about this and see what more we can do on that side of this really important discussion. Well, I don't see any other questions or thoughts from my colleagues, so thank you all so much. Can I get a motion to move the $300,000 supplemental appropriation to HHS's budget?
So moved.
Second.
All right, and so all those in favor? That's an easy one. It is unanimous. So Ms. McMillan, was there anything else we needed to cover this morning?
That is all, and this will be scheduled for public hearing and action on October 19th.
Great, and thank you, Ms. McMillan, for squeezing this in as quickly as we have, because we needed to move this forward quickly. So appreciate that. Yes, of course.
Just very quickly, and this is just for afterwards, if we could just get a demographic breakdown of who the individuals are, what they are, once we've had them housed, just so we have that information, that would be helpful.
Great point. All right, so thank you, everybody. I believe with that, we are adjourned this morning. Take care.